This is a CJASON podcast, and I am Dr. Killian Donovan, Nephrology Registrar from Oxford, UK. I am excited to share with you our recent paper, Fibroblast Growth Factor 23 and Risk of Cardiovascular Diseases, a Mendelian Randomization Study. Blood levels of fibroblast growth factor 23, or FGF23, have long been known to rise to very high levels in patients with CKD, and levels of FGF23 have strong epidemiological associations with cardiovascular outcomes, including heart failure, myocardial infarction, and stroke. It is important to determine whether these associations are causal or not, because this would have implications for the development of FGF23 targeted therapies. Conventional observational epidemiology cannot reliably distinguish between causal and non-causal associations in this context due to the presence of significant confounders, chiefly kidney disease, and the possibility of reverse causation. Mendelian randomization techniques, which use genetic variants associated with FGF23 as instrumental variables, can minimize the effect of confounding and reverse causation, and thus allow us to estimate more accurately the causal link between FGF23 and cardiovascular diseases. We used genotyping and proteomic data from 18,000 participants collated by the International SCOLLOP Consortium to estimate associations between genetic variants and blood FGF23. We used this data to derive a genetic score based on genotype at 34 variants, which accounted for 6% of the inter-individual variance of FGF23 levels. We validated this score in a cohort with measured FGF23 from an international randomized controlled trial. This validated score was then used as an exposure in logistic regression analyses in 350,000 white ancestry UK biobank participants to quantify the association of genetically predicted FGF23 with cardiovascular outcomes. We did not observe any significant association between genetically predicted FGF23 and atherosclerotic or non-atherosclerotic cardiovascular diseases. To ensure we did not miss small effect sizes due to insufficient power in UK Biobank, we conducted further analyses in larger international case control consortia for coronary artery disease, using the Cardiogram Consortium, for stroke, using the Megastroke Consortium, and heart failure, using the Hermes HF Consortium. We did not observe significant disease associations in these cohorts either. Our findings were consistent in sensitivity analyses using different methods for variant selection and removing potentially pleiotropic variants. This work demonstrates that FGF23 is very unlikely to be a cause of cardiovascular disease, and that the conventionally observed associations between FGF23 and cardiovascular diseases are likely due to residual confounding. This further illustrates the point that conventional observational studies of relationships potentially confounded by kidney function or kidney disease should be interpreted cautiously, as adjusting fully for confounding in this context is very challenging.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.